Now, joining us for more on this is the Director General, Cross River State Primary Healthcare Development Agency, Dr. Janet Ekpenyong. A pleasure having you with us on the program. Now, let's begin with the access to PPEs by health workers. First, we'd like you to unmute your audio so that we can hear you loud and clear, Dr. Ekpenyong.
Thank you very much, Melinda. It's always a pleasure. Yes, so recently the federal government, of course, through the National Primary Healthcare Development Agency and the NCDC have actually distributed some PPEs to states, Cross River State inclusive, and currently all the facilities, at least all the primary healthcare facilities, as well as some secondary facilities have actually received some of these PPEs. So that include face masks, hand washing stations, as well as hand sanitizer and several other things to help us in our fight against COVID-19, particularly in our facilities, and also to at least protect the health workers.
Now, what plans is your agency putting in place, especially in the wake of the COVID-19 third wave and the Delta variant that is creeping into the country?
Yes, so we've had to reactivate our Public Health Emergency Operations Center. Now we are meeting regularly compared to a few weeks back because of the new variants that has been recorded in the country. So we've had to also activate our surveillance in all our local governments, our disease surveillance and notification officers. They are all on alert, doing as much as possible. And of course, ensure that all the thematic areas in our public health response, each and every one is up and doing. We also want to intensify testing in Cross River State, while also ensuring that we intensify our sensitization and creating all the necessary awareness to ensure that our people are really, really alert, so that at least we end up not recording the Delta variant in Cross River State. So right now we are really, we've really activated our EOC and several other response just to make sure that we're able to mitigate the virus, not just the Delta variant, but the entire COVID-19, the virus itself.
A lot of funds will be needed at this crucial time. So tell us about the COVID-19 fund management in Cross River State at the moment.
Oh, yes. So the state government, of course, His Excellency Senator Professor Benayade has been very magnanimous towards the health sector. He's tried as much as possible to prioritize health, especially in this very challenging period. And also the federal government had actually supported us over the past months to see how we can also fight in terms of supporting logistics, as well as other things that are required. But at this moment, especially now that we are beginning to record the new variant, I think we have to be very proactive enough. This is the time where more support will be needed in various states. At least we know we did a lot in terms of trying to push back the virus. But right now, we'll need more support even to strengthen laboratory services, strengthen logistics, strengthen point of entries, strengthen risk communication and every other thematic areas in this response. So a lot of support is really still needed because there's a limit to how far most states can go because of other competing priorities. So I need a lot of states really need more support these trying times.
Now, Dr. Ekpenyong, the Nigerian Governors Forum just met recently and they're calling for consensual action regarding COVID-19, especially with this third wave, drawing from the recent cases in Lagos, which the governor, Babajide Sanwo-Olu, mentioned to his colleagues. And they are asking that all state governors must revive their COVID protocols and collaborate with other agencies, not just the NCDC, but agencies like yours. So what are you guys going to be doing in this regard?
Okay, so when we talk about the Emergency Operations Center, it's not just the Ministry of Health or the Primary Healthcare Agency. It has some other MDAs involved, including military and paramilitary organizations, because you require everyone to come together to help to fight this pandemic. For instance, even at the point of entry, you need to work with the Air Force, you need to work with immigration, you need to work with Navy. So it's not just a health sector thing, it encompasses other MDAs as well. So we in Cross River State, like I said, we're already having our meetings and just to reactivate what was already existing, that existed over the year. So right now, a lot of meetings we've had to reactivate the EOC. Those who are in charge of the point of entries, they've also been notified, they've intensified their work at the point of entries. Also, those who are in charge of laboratory services, of course, like I said, it's not just the health sector, it's every other MDs are all engaged. So right now, even at the national level, I think that proactiveness needs to be applied as well, so that we can mitigate this before it becomes a very severe, going to a severe situation.
Now let's look at the vaccination exercise, end of phase 1, and what's the fillers you're getting regarding the acceptance by the citizens, especially the residents in Cross River State?
Last week, we concluded the first phase of the COVID-19 vaccination. And I'm glad to state here that Cross River State was actually one of the states where we had a very good response in terms of uptake of the vaccine. And we are very encouraged with the turnout so far and the response we've had so far. And we're also very encouraged that when the next batch of vaccines will be coming, we know that more Cross Riverians will be demanding for the vaccine. And of course, we had our challenges at the beginning, but eventually, with so much sensitization and, of course, working with several organizations, both the traditional, religious, and other institutions, we're able to surmount all those challenges. And I'm very, very pleased with the uptake so far in Cross River State. And I'm sure that if we have the same response in other states and the entire country, hopefully we'll be able to achieve the 70% coverage we are targeting, and also be able to ensure that we can reduce the spread of the virus in the country.
Dr. Janet Ekpenyong, always a pleasure having you with us on News Across Nigeria.